All right, we have another interesting guest. Mitesh is here, and we're going to be talking about some oral testosterone strategies with Casotrax. And I'm super excited because this is just on the tip of everybody's tongue these days. It's like we've gotten to a point where the market's starting to be super hyper aware of different types of strategies. So why don't you introduce yourself, and then let's talk through the business model. Let's talk about things that are important, and get on with what I think is the key thing here, which is that this is another addition that most people don't have, and it's like it's so easy to add. That's what gets me.
Yeah. Hi. Thanks, Matt. So my name is Mitesh Patel. I'm the Chief Business Officer here at Marius Pharmaceuticals. And what Matt is talking about is this exceptional opportunity that we have for clinics and prescribers to grow their patients by both attracting new patients and retaining them. Our drug, Kaisertrax, is an FDA-approved oral testosterone replacement therapy. Its effectiveness, safety profile, and convenience ensures high patient satisfaction and adherence, which then translates into rewarding financial model for clinics, which I'll detail a little bit later. Another important factor that you ought to know about right in the intro is our cash pay model avoids insurance company pre-auths, rejections, and delays so that patients can get the therapy started as soon as possible, and clinics don't have that administrative overhead of and headaches of dealing with PBMs.
And that's the goal here. Like we know the jig's up. Look, if you are not taking in cash paying strategies with something as simple and as non-evasive as what you're doing, I mean, why not? It's what's the downside? I mean,
Exactly.
there's no there's really not any cost here. There's like no reusables, there's no, it's crazy how like adoptable there are things in this market that people are not aware of. So talk a little bit about that. Talk a little bit about what your sense is as well. I mean, because obviously the model's out there. We've talked about it a couple of times, and we have a lot of people who are now asking for this solution.
So what we've done with Kaisertrax since we launched it is we've gotten a tremendous response from the market. Patients and clinicians recognize these advantages of Kaisertrax because primarily it's convenient and it's easy. It mitigates the highs and lows of T levels associated with other treatments that you're well aware of. Its effectiveness has been proven through clinical trials, and it has an excellent safety profile. Right. Kaisertrax can increase the free testosterone level substantially also because we lowered the SHBGs in a man's body. So no patients left our clinical trials due to erythrocytosis. So management of patients taking Kaisertrax is a lot easier. And lastly, pituitary functions remain intact. So we've seen active LH and FSH levels also. And therefore we got no reported cases of testicular atrophy.
Yeah, and that's a big one because that's the big concern that everybody has.
Yeah.
Is this going to impact me and dysfunctions? And, this is the whole center of the universe for this business. So love it. Sounds great. But everybody wants to know, how much money can I make and how quickly can I make it?
All right. So that's we make it very easy for both patients and prescribers and clinics to benefit from this, right? Our pricing strategy and the demand for this premium TRT allow for healthy margins for prescribers. So our current partners are pricing Kaisertrax anywhere from $160 up to $250 per month. And with our wholesale pricing at $120, if clinics charge, let's say in that middle range, like $210 to $220 per bottle, they can generate somewhere between $90,000 to $100,000 in annual profit for every 100 patients they have. So yeah, it's one other point to add, right, is because Kaisertrax is easy and the benefits it provides, patients' adherence is stronger. That then leads to long-term prescriptions and ongoing profitability for the clinics.
And that's the story, right? Because we're really talking about recurring revenue streams that don't go away.
Right.
And this is the story, right? We working with testosterone versus working with semaglutide versus working with something else. The goal is long-term patient stability and a census that stays with you, as you move through your modalities of different things that are offered in the market, and that there always is now an opportunity to have these patients who are now into production buying other things, but the acquisition of these patients and the onboarding is a nothing burger. And
Right.
that's the key, right? So what else should I know? So let's just say I'm super excited. Great, this sounds great. What do I do to get into production? What's really involved with the relationship with the pharmacy or with your production units, and understanding like where things go from there?
All right. So one, it's really, physicians and in most states, PAs and NPs can prescribe Kaisertrax, right? And we offer three options for getting Kaisertrax to your patients. Just again, give you a choice of options and making it easy for patients to get the Kaisertrax. First one is we partner with specialty pharmacies to ensure smooth prescription fulfillment and patient support. Second way is we also offer bill clinic model where the prescriber collects the payment, pharmacy sends the prescriptions directly to the patient, and then charging the wholesale price back to the clinic. And then for practices in the states where clinics can dispense controlled substances, we offer an IOD model. And this provides an additional revenue stream to your IOD already and increase, patient convenience to pick it up when they come in for their appointments.
I like that second model a lot. It eliminates thoughts on concerns around even people who want to do multi-state strategies, where they might not be licensed, so they're concerned about payment strategies because of restrictions and all sorts of things that pop up when you start to think about having a wider footprint for distribution. But in all earnesty, it's like you don't have to do anything to get started. Like,
Nope.
that's the funny part, is that thing of trying to create an artificial barrier for this particular product by saying, oh, I need X, I need Y. Hello. No, not really. You actually just need to have the willing participant that you can solve his or her problems. And that's the biggest thing that you should be concerned about. At the end of the day, the market is insatiable to a degree for this world of what I think is burgeoning, of the education first on what needs to be thought through as people go into, let's just say, understanding what this means for them as a patient. But as we age, or as the entire population ages, it's the alternatives to some of the more stronger, or I should say, potentially, I won't say hazardous, but I will say the effects and side effects where people sometimes can't, even if they're just starting this journey, there are some opportunities for them to now have a completely different modality, which wasn't really available. I mean, this is a new category to a degree, and that's why I'm excited to, talk to people and let people know who are out there trying to help patients. Like, this is another trick in the bag that brings people in, that solves huge problems, that if you're so inclined to want to be a multidisciplinary, we deal with a lot of med spas, and we deal with a lot of weight loss centers, and all these folks that are doing different modalities. Here's another thing that adds to your value and you can bring to your customer base.
Yep, absolutely.
Is there anything else you want to chat about, or any topics that we didn't cover that I should have asked you about?
I think just that, I just want to underscore that Kazatrex is already being prescribed. Has been prescribed to thousands of patients through a growing number of clinics, telehealth partners, hormone clinics, concierge medicine providers, and many prescribers also use Kazatrex as a co-therapy. You mentioned, these clinics all offer different modalities. So as co-therapy, for example, along with semaglutide. So GLP-1 drugs are very effective for weight loss, but 30% or more of that weight loss can come from muscle loss. So the prescribers are, finding that testosterone and Kazatrex makes it very convenient, is a good way for their patients to maintain that muscle mass as they're losing weight.
Absolutely. And we know this as we've all seen, if you haven't been on social media, seeing the semi-glutide face, as they call it, it's just because the muscle mass is disappearing. And so we know this. And so these, there's so many things to think about in production of, co-therapies, as you just mentioned, but also in the fact that, you can do some prevent defense at the same time to have the most beneficial experience for the consumer or the patient already be placed into production so that you're not chasing down, let's just say, alternative therapies. And look, it could be anything from using Botox to rebuild or fillers to rebuild a face, or any of these other modalities, skin resurfacing, millions of things. But here's something that actually does the internal work for you. So it's a great solution.
Yep.
Good. So I think, look, this is something that, if you're watching this video, there'll be information either as part of this in the video. If you're finding this video through YouTube or through our podcast, you'll find this information located near this. Any parting words about this?
No, I just want to reemphasize what you said about, it can get started immediately. And the easiest way to get started is just contact us at info@mariuspharma.com or go to kazatrex.com/prescriber website and schedule a call from there with us. We can get you set up and going within 2 days because we have all that infrastructure and pharmacy partnerships and everything already in place. Right? And to find out even more information, we have a disease awareness website at rethinktestosterone.com. And of course, kazatrex.com has lots of useful information, including downloadable brochures, prescribing information, and treatment protocols. And even for more education, you can register for our regular education calls that we have weekly or bi-weekly, focusing on clinical outcomes and best practices.
So we'll put all that information in this video at the bottom, or wherever you're watching this video, you'll see the information. Thank you so much. I really appreciate it, Mitesh, and we're looking forward to, helping other clinicians and other people who are in this business to grow their business, find good solutions, and like what we did today, discover potentially something that could really have an impact for their customer base.
Yep, absolutely. Thank you.